Hi, my name is Dr. Ross Hauser. Welcome to Caring Medical Florida. I'm going to explain here a little bit of the neurology of swallowing and speech. Many people have difficulty with swallowing or changes in their swallowing. Food gets caught, they get regurgitation. Other people, they lose their voice, like their voice gets hoarse, they can't sing, their voice changes, or they might have symptoms. They may get headaches just when they speak a lot. And there's been no one that's been able to explain why that occurs. Swallowing involves many of the cranial nerves. We see here there's cranial nerve 5, the trigeminal nerve, the facial nerve, which is cranial nerve 7, the vagus nerve, which is cranial nerve 10, and the hypoglossal nerve, which is cranial nerve 12. One of the nerves also is the glossopharyngeal nerve, which is cranial nerve 9. All of these nerves innervate muscles that are involved with swallowing. The vagus nerve also innervates the muscles that open and close the vocal cords. So that's where a person who has hoarseness or changes in their voice, or maybe they can't sing anymore, or they get tired quicker. They get tired quicker. They can't talk as much, or they can't sing as much. Basically because they have muscular weakness in their vocal cords, because something is hampering the nerve impulses from the cranial nerves. And what that is upper cervical or cervical instability. The cranial nerves that are involved with swallowing, we talked about cranial nerve 5, trigeminal nerve, facial nerve, cranial nerve 7, glossopharyngeal nerve, cranial nerve 9, vagus nerve, cranial nerve 10, the hypoglossal nerve, cranial nerve 12. All run very close to the anterior cervical vertebrae, especially C1, C2. When somebody does have cervical instability, it's normally because of excessive stretching of the ligaments in the back of the neck. When these ligaments are weakened, injured, torn, what happens is the cervical vertebrae move forward. When they move forward, they can impair the nerve impulses through these various nerves. So thus, the muscles that are involved with talking, or the muscles that have to do with contraction and swallowing, they get weakened. They don't function correctly. So you get difficulty swallowing, feel like you've got a lot of secretions and you're choking on your secretions, or there's changes of voice quality. The person's ability to speak goes down. It's almost like the muscles are too weak to speak. The good news is all these symptoms are totally reversible once the cervical spine gets stabilized and the cervical curve gets back to normal. The way we do that is by a procedure called prolotherapy. Prolotherapy involves injections to the various ligaments in the neck that are overstretched. The prolotherapy causes a tightening of those ligaments. Once the nerve impulses to the muscles of speech and swallowing and singing get back to normal, so do those functions. So the prognosis is very good when cervical instability is the cause of speech and swallowing and speaking difficulties or changes in speech and swallowing. Prolotherapy, by tightening up the ligaments and resolving the cervical instability and helping with the cervical curve get back to normal, the speech, swallowing, and singing gets back to normal.